Here we go. Hi, I'm Dr. Susan Thompson, and my guest for this interview is Shaun Salzman, newly minted LPC, a former resident of mine. And I'm grateful, Shaun, that you agreed to spend a little bit of time with me talking about your exam preparation and also what the exam was like, because it's been a
Absolutely.
recent memory and better capture it now than a year or so from now. So you took the exam just a couple of months ago. What are the ways that you prepared?
The best way that I prepared, I did notice that since I took it a little bit later in September, that over the summer, the counselingexam.com, I feel like those study questions really help the practice exams. I really noticed as well the DSM-5, just nothing kind of hit better than home than actually going over the diagnosis criteria and the symptoms. I think one of the things that I was really surprised with, I know everybody has a different experience with their test, but rather than so many questions and scenarios asking me what the diagnosis was, my particular experience was I actually had given a lot of the diagnosis and said, given that this is a diagnosis, what is the differential diagnosis? I actually feel like I had more of those questions for differential than I did for actually what is your diagnostic impression.
Okay. And going back over then, the DSM made a difference for you feeling prepared for that part. I know that some people, go ahead.
Oh, I was going to say, yeah, absolutely. I think what I was doing was it ended up kind of helping me out with that secondary sense, because I was really honing in on just making sure I knew the diagnostic criteria. But once I felt comfortable, I really hit home on the secondary diagnosis or the rule out, which I'm glad I did, because I felt like that was more content oriented for me.
Okay. I know that a lot of people that I've worked with have said when they've done counselorexam.com, they don't end up passing many of the practice exams. What was your experience on that?
Verbatim, I had the same thing. I would do, I started off failing all of them, and then when I would hone in on assessment, that was a big strength, and then the other clinical kind of fell off. So I find myself kind of in an ebb and flow of one area I would pass, the other area I would fail. And then in the area I would fail in, I would focus on, and then the other thing would fall by the wayside and I would fail. So that was definitely a hindrance and a worry for me. But I think having taken those tests and those exams, it gave you kind of a good feel for at least the format of the test, the actual test itself.
It's a pretty unique format too. Most people have never taken an exam with this kind of format.
No, neither did I. So it was definitely a learning curve for me, not only with the practice, but then going into actual test time with this kind of formatted test was definitely a first for myself as well.
And it sounds like you also had a version of the exam where you were really being asked to look at differential diagnoses. Is that what you're saying?
Yes, absolutely.
What else stands out about the exam itself as you were taking it?
I think what the benefactor for me was with especially taking the test, even though I didn't pass all the practice exams, the practice exam also gave you a good feel for not the format, but as you know, it asks you what are all the possible right answers. So for instance, you could pick 2 of the right answers, but there also could be 7 more questions that you missed. So even by, consistently not passing the practice exams, it still got you in that right mindset to think, okay, it's not just a run-of-the-mill, multiple choice, one and done answer. There could only be one. And they were questions where it sounds like there's only one answer, and there's actually 5 answers to the question. So I think having that practice, having that type of insight also helped myself out a lot as well.
It makes me wonder then if for someone who's just starting to look at counselorexam.com and a practice exam, to maybe just intentionally fail, intentionally answer all the questions so you have an idea of what the right answers might be.
Yeah, to be honest with you, that crossed my mind as well. And I actually tried that on one of the quizzes and quickly realized, thankfully, before I had the test, that I got the answers, but even though I got the answers, all of the application questions are completely different. So for instance, if it's, Sally's a 35-year-old female and this is presenting, okay, well, if this is the same 35-year-old question in this age range with this depressive symptoms, I'll get it and I'll understand it. And I quickly realized, even with taking the practice test, that didn't help me do better on the practice test.
Okay.
So by actually trying, it gave you that not only knowledge but insight instead of just what's right or wrong or where your thinking was or was not. And it still helped me to kind of alter and adjust. So then that way, when I did take the test, kind of having that mindset of, okay, this is a completely different scenario. And it kind of almost made me remember the whole unconditional positive regard. You do that with your clients and your patients, but you actually had to do that with the scenarios as well. And I think that they purposely did that to try to figure out, okay, this is a completely different scenario, so what would you do?
Okay. All right. So maybe just the idea of knowing that most people end up failing the practice exams and then using them really truly to get a handle on how the exam is structured more than anything else is a reasonable mindset.
Yeah, I would say absolutely, because all of my other cohorts and peers and colleagues above me that have been in the field for a few years or had just taken a test before me, I did not run into one person that said, hey, I did counselingexam.com and I aced all the tests and it was fine for me. Literally 10 out of 10 across the board. Every single person I talked to before me said, I failed all the exams. I continued to fail all the exams, but I still continued to practice and to take them.
Yeah.
And then once I at least felt comfortable, no, I feel like I have enough information, went and passed it on the first try.
Right.
I did not run into one single person who said, hey, I passed all the exams and I got to it and it was easy peasy. So
yeah, I haven't run into anybody either. And I guess part of the reason I'm focusing on this is that, as someone who has been in the field and someone who finished a master's degree, you have a certain level of success. Like you've passed your tests for your master's degree, you've passed all kinds of other tests, and to get faced with this, oh my gosh, I'm not passing, what am I going to do? That really is part of the practice for this particular exam.
Mm-hmm. Yeah, absolutely. And I think what also helped me in a sense that with the stress and the anxiety that came from I'm not passing, I have this exam in 2 weeks. What helped me out is I feel like in my own personal study habits, that's why I did the test first and then went to the DSM, because I felt like, hey, if I keep on failing, and then having this literally a day before and just keep on failing, that might not put me in the right mindset. So what I do know is I'm familiar with the DSM. Let me just even strengthen that even more and then hone in, case in point, on the secondary diagnosis, what I'm not too familiar with. And then that ended up paying off dividends for me.
Great. That's great. And so how much time would you say that you spent studying?
I would say with the test, when I mean over the summer, it literally wasn't every day. I would say on average, I took probably anywhere between 5 and 7 exams, maybe a week, over a 2 to 3 month time span. And even some weeks I wasn't even able to do half of that. And then I would say I would probably say about 14 to 17 days. That's when I really honed in, and every single day I went into the DSM. And then also that there's a 600-page manual that the counseling exam offers as well, that one of my cohorts obviously had as well. And that also helped me because it was just it was handbook. There were some practice exams on there, but it was a lot more traditional kind of study content. Mm-hmm. So that's what I really focused on. I would probably say the last 2 weeks leading up to it.
Okay. I think that's helpful. I know that that's going to be useful for folks. So anything else that stands out as you were taking the exam itself? Questions that were asked, or things that passed through your mind, or just things that you want to let other folks know?
Yeah, I would say whether you take the practice exam or not, or whether you just alternative study habits and go right into the test, watch out for the wording as well. I think the wording is pretty tricky, where it says, it may say choose what you believe is the best possible answer, But obviously, if it says what is the best possible answer, that technically is a loophole for not choose the only answer. So some questions make it lead that I need to only pick one, but a lot of times there are 4 or 5 questions that you need to pick. My biggest thing that I focus on, and I'm glad I did, is there are some that says choose the right answer only before going on. That's when you know that there is only one singular answer. Other ones, they are very tricky with the wording, and they'll make it sound like it's one answer when it's 4 or 5, and vice versa. Sometimes they say choose the best possible answers, and there's only one, maybe 2 out of a whole list of 8 or 9 possible outcomes.
Mm-hmm. And I think with that, just understand that that all you have to do is pass. That was my mantra when I was
Absolutely.
taking the exam a few years ago. All I have to do is pass. I don't have to make an A, and it's okay to make mistakes. It's okay to miss some. All I have to do is pass. What was your mental preparation?
In regards to that, I would say I definitely had my oh no moment about halfway through the test when there was one scenario that was a whole case that was pretty tough, and it was wrong. And I was like, oh man, it was only to choose the only one. So that's when I really kind of honed in and said, okay, I could go into full meltdown mode and give up, or I can try my best and take necessary risks, meaning I did get to a point where I went, well, do I only click what I know and not take any risks, and I know there's other answers, but then I'm already hit with this. And I think having that mindset, I need to just assess the situation. If I feel like this is best, go for it. And in all honesty, with full transparency, it helped me because I myself, I think I only passed by 1 or 2 questions. So had I not taken those chances and went with, okay, I feel like this is an issue, instead of going, I need to play it safe, it actually helped me get the required points necessary to pass the exam. So I would say when you see the red, nothing like that, don't, okay, I can't guess anymore, because that can actually hurt you worse if you played a little bit more.
I think that's great advice for folks. Any other advice that you want to give?
Get plenty of rest, because you're definitely going to be, nervous. It was for me personally. Others may feel a little bit more confident going into it. I was just a little bit nervous, even like eating that morning, but I'm glad I did, because obviously you don't want to go in with headaches, and kind of the getting back to basics, taking care of yourself. Those small things go a long way, especially in a 3-hour exam room as well.
Yeah. All right. So if there's any other kind of closing comments, anything that you'd want people to know or think about or have in mind as they're preparing, or even in the exam? Last minute.
Yeah, I would say in regards to case study, whether you decide to do the exam.com or not, always mixing up the study pattern can absolutely work, because again, there's all types of content. And all different professionals make the test. So one case scenario can be presented in a certain way, and then you get to scenario 2. And not only is it a different case, but the format or the content can be worded completely differently. So I would say by using other study guides, study habits, if you have yourselves, anybody watching or viewing this, your own idea of what you might do, absolutely add to it. There's kind of no, I would say in my opinion, no right way or wrong way where you have to use counseling exam or you have to only do the DSM. I think by having other alternative forms kind of helps gain a better perspective as well.
That's great. Thank you for that. And then I guess maybe last thing is, how long did it take you to actually get your concrete license before after taking the exam?
Yeah, that one was a little tricky, because once you get your hours, right? Yeah, they tell you that day, and then I would say I believe that was mid-September. So I believe, if I have my date correct, it was about September 14th, and I believe right about at October 8th or so I got it. So just guesstimation, I think it's usually anywhere between 4 and 6 weeks, and that's right around the time frame that I got mine.
Okay. All right. Yeah. Sometimes it's all the way at 6 weeks, and sometimes it's a little bit earlier, but great. So you have eventually I'll ask you off screen like what your license number is. We'll do a little comparison there. But
okay.
So thank you so much. I really appreciate the time that you've spent and the information that you're offering to other folks who will be taking the exam in the next, 6 months to a year or even 2 years. I know that they'll find it really helpful. And I just want to say I have appreciated working with you over what was it, at least a year, if not longer, right?
It was.
Yeah.
Yeah.
And it's so good to see you. And I'm so glad that you crossed that finish line and are starting a new chapter of your life. So I'm gonna.
Thank you.
Yeah. So I'm gonna stop the recording.